Hey, this is Doug Field, along with my co-host Brent Macy, and welcome back to Healthcare Consumerism Radio. And joining us to really talk about their eHealth initiatives and what's happening around a new mobile app that they're introducing is Dr. Ellen Roga with Stat Doctors. Nice to have you with us again, Ellen.
Thank you so much.
Yeah, give us a little backgrounder on Stat Doctors for those who might not know you, and then we'll move in to talk about this new mobile app and some things you're doing.
Sure. Thank you very much. So I am founder and CEO of Stat Doctors, and Stat Doctors is an eHealth solution. What we do is basically provide a virtual house call whereby we connect members with our national network of board-certified emergency room physicians to diagnose and treat minor conditions that would normally be seen in an ER or urgent care center, utilizing a proprietary technology that, as we'll talk about with mobile apps, internet-based or landline, whatever modality really the patient has, they can connect with our doctors to diagnose and treat approximately 20% of illnesses that would go to emergency room and about 80% that would go to a primary care doctor or urgent care center. Pink eye, sinus infection, coughs and colds, vomiting, diarrhea, medication refills, rashes, aches, and sprains, minor things, but when they pop up, because of the limited access to care, often people are going to higher cost settings. Mm-hmm. And by translating them to a virtual visit, it translates to reduced health plan costs for plan sponsors and also improved member satisfaction. Working with employers and insurance carriers, what we've been able to do is really drive down plan costs and really improve the experience for their members, which has been great. We're very metric-driven. We see patients in 6 minutes. And 98% of patients would recommend and use it again.
Oh, that's great. That's great to hear. Now, tell our audience about your new launch. You just developed a new mobile app.
Sure. So, clearly the era of mobile health is here, and the proliferation of smartphones has really driven the industry towards mobile solutions. So, about a year ago, and we've been around since about 2009. Starting originally with really an internet-based version and a telephonic version. But what we found over a year ago was about 60% of our users were actually accessing our physicians through their smartphones. So what the data showed us is that, hey, we're now evolved to a mobile community, and that spanned really all age groups. And one thing that was pretty powerful for us is that we actually had a medically indigent population of about 17,000 members in California, and 55% had smartphones and were accessing Stat Doctors. So we sort of used a lot of data to say that, clearly that's where people are and how people are accessing care. So we made a major investment in developing a mobile application that is a complete solution similar to our internet version. Mm-hmm. And that's what drove the desire to head that way. It was really the patient's needs and how we're accessing care. And it's been a huge success. It's been a great satisfier for the patients and our members, and been, just a phenomenal experience for them based on our feedback.
Ellen, there's a proliferation of apps out there around digital health, eHealth, whatever brand we kind of want to put on it. So what makes yours kind of stand apart from the others?
Well, I think one of the things, the approach that we took on it was that we wanted a complete solution. Mm-hmm. So there's a lot of different ways that you can essentially position an app. But what we said is, look, members and patients are looking for a complete care delivery model. Mm-hmm. So what we found was a couple of things. First off, video is a great satisfier for the patient. And it's also a great satisfier, by the way, for the physicians as well, who's an important stakeholder in the interaction. Mm-hmm. So when we embarked on designing our mobile app, we wanted to make sure that video and the ability to see the physician face-to-face was key to the interaction. And then having all the features that you would expect from a care delivery model, and a complete care delivery model was important. So accessing records, payment processing systems, electronic prescriptions, again, video encounter, knowledge about your physician, managing your account and your family members, and bringing a complete solution to the patient was really important to us as we designed our app. So as opposed to just simply making it a telephone call or a scheduling module, we brought all the features of what you'd expect for a solution that replicates a doctor-patient relationship into a mobile solution.
And now, so you can e-prescribe through your app?
Correct.
Now, are there some restrictions across the country? Aren't there some limitations in some states, or, where is that today, Alan?
Well, certainly what's fairly well accepted is that any scheduled substance, so any medication that would need a DEA number, would be something that you would not do through an e-prescribed program, through an eHealth visit. Lifestyle medications, so Viagra and Cialis and things that would be in that category also would be prohibited from an e-visit, e-prescribed solution.
Okay. Hey, Alan, this is Brent. So when we're looking at your solutions, who can actually use Stat Doctors? Is it something that you had mentioned, you had alluded at the beginning, employers? Are there some other channels that you guys go through with your solutions?
So with our solution, we have found that the best way to really engage the consumer is through a plan sponsor. So we go through either an employer-sponsored plan or an insurance carrier or a hospital system as well. So there's always a plan sponsor, because what that does is allows you to message the end user very, very well. Because while while eHealth is a wonderful solution and a wonderful delivery model, it's still at the point where society and people are just learning about it. And you want to be very careful and very pointed about what it's for. What are the solutions that, or what are the situations that it's appropriate for, and how do you educate the public? There are opportunities to go directly to consumer, but what we've found is that it's challenging to really educate the consumer directly. So we've opted to always go through a plan sponsor.
So what's the next generation of the app for you? Where are you going to go with your apps?
So we've had so much success on the patient side that we are a couple of weeks away actually from launching our physician app. What we found was the data again showing that a majority of patients were looking for mobile solutions. Physicians want them as well. And if you look at what the eHealth space does, it's basically bringing a doctor and a patient together electronically. So, the doctor being a very important stakeholder in the reaction, and really your delivery is only as good as your doctor and your technology. So our next iteration is a physician app, which we're a couple of weeks away actually from launching. And it's got some incredible features to further improve the patient experience. So, really the ability to know more about the member, know more about the patient, and pulling data from different sources, and the ability to have templated charting, so ways that doctors have tools that they can provide better care for patients. And the feedback from our physicians has been also phenomenal on it. So they're very excited about it. And I think what that does is now you've got sort of both parties, the patient and the doctor, completely mobile, where you can create really now a ecosystem of care between the two of them.
Now, Alan, where do you, let's look kind of into the crystal ball. Where do you see, the eHealth and mobile health care marketplace really moving in the next 5 to 7 years here?
I think we've just scratched the surface on the eHealth solution and mobile health. I mean, the industry right now is primarily focused around minor conditions and proof of concept, connecting patients and doctors together through mobile solutions and electronic health delivery. As you start to look towards where really the industry is going and where healthcare is going, people are now getting very sophisticated about their healthcare knowledge. Where are the dollars flowing? I think what you're going to see are really, again, these sort of ecosystems of care mobilely, but more importantly, mobile health and eHealth focusing on high-cost claims and high-cost coverage. So looking at condition management or chronic condition care, at hooking into existing wellness programs, at identifying different opportunities within a plan that are really driving a lot of the costs, and then different provider groups. You've got areas right now where primarily eHealth and telemedicine has been focused on radiology, psychiatry, dermatology, and now sort of acute care, minor illness. But you'll see other specialty providers and subspecialists on platforms like this.
We got about a minute left on the program, and if you could, leave our audience with kind of one or two good takeaways on what they need to be considering when looking at your solution, and then let them know how they can find you.
Sure. So I think looking at our solution or eHealth in general, so first off, statdoctors.com is our website. And then looking at eHealth solutions, I think you got to look at really a couple of things. What's the quality of provider? Because, again, it's a doctor-patient interaction. And can you replicate a visit? Make sure that this is something that is equivalent to an in-person visit, because there should be no shortcuts here. And at the end of the day, it's phenomenal care.
Now, when you look at, just for my knowledge, can this app be downloaded on multiple mobile devices that are out there? I know everyone's got their cell phone markets. There's a bunch of cell phones out there. Can it be downloaded to most of the major cell phone carriers?
Yeah, iTunes and Google. iTunes and Google Play right now are the two main ones that we're on, and it'll be downloaded.
All right, Alan. Hey, we really appreciate you joining us on the program today. Have a great weekend out there on the West Coast, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.